and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Dr. C. Nicole Swiner. She's a family physician, speaker, author, publisher. Is there something that you don't do?
Probably not sleep enough. I probably need to sleep.
Nicole, welcome to the show.
Thanks for having me, Kevin. It's good to see you.
So I was wondering if you could start by sharing your story and your journey to where you are today.
Yeah, well, I have been in family medicine in private practice now for about 13 or so years, and that's been most of what I've done since residency. I started out as a person that worked with a hospital-owned clinic, and then we kind of forcibly became entrepreneurs, and we have a private practice now that I co-own. But that's, my main gig. And then, shortly after becoming a working physician and entrepreneur, I soon learned that I had trouble balancing all these things I was supposed to do. Because then I got married and had 2 kids and was running a business, et cetera, and had a lot of stress and felt overwhelmed and was not getting enough sleep, et cetera. And so I started to learn more and more about the Superwoman complex, which is what I talk about and speak about and write about a lot. And so that's kind of become my side gig / passion, because from that I started doing some writing for local magazines and articles in the newspaper. And then with the help of Kevin MD, I've been able to travel locally and nationally and do speaking engagements. And then once I started writing books on Superwoman, the Superwoman complex, I had more and more friends and colleagues to ask me how I did it. And can you teach me? And can you help me publish? And that's how literally Swiner Publishing was born. So now I kind of do that as well. And I've been able to cut back more and more on clinical practice and do a lot of these other things that are fun. And thankfully, I'm able to make a little bit of money from that too.
Fantastic. Well, it's clear that we are going through historic times. We have twin public health crises. We have the pandemic, and we have the nationwide protests against racial injustice. I was wondering if you could share your perspective on the protests and the current racial climate in our country.
It's been very interesting, living as a Black person, practicing as a Black doctor in general, clearly, and having to deal with a lot of these injustices, my whole life. It's just kind of part of what, when I was growing up, my parents taught me how to navigate and move, in different circles, and how to protect yourself and behave in certain instances, like if you were pulled over by the police or if you were approached in certain situations. So it's always, of course, been a part of me. But this time in the world is, particularly interesting because we've been dealing with racism, as a public health issue for forever. But I think because now people are at home and we are all kind of stuck to the screens, we're watching all the news, all the social media, looking at our phones 24/7, I think it's literally in our face more now. And so you have to deal with it. The horrible killings of George Floyd and Breonna Taylor and multiple others that have unfortunately been broadcasted for the world to see have fortunately brought these things to light. And now we have to deal with it. And the protests have been very vocal about, now being the time to address it. So it's a very interesting time we're living in right now.
So is there something about these protests that make them different from those of the past?
I'm not sure if they're different. I mean, I love the fact that our young folks are, young, I'm 42, but I love the fact that, the millennials and the Gen Xers are now getting heavily involved. I think there was this misconception, particularly with those in the younger generations, that racism was over. We are one big happy world, and the things that happened in the civil rights era, we're through with that. We're done with that. When clearly we weren't. So I love that they have become more vocal. They have become more involved. They understand more what's happening, what our ancestors were fighting for, and now they're ready to really address it and get some things fixed and done.
So in order for us to have any enduring change, what do you think needs to happen going forward?
Yeah. Well, I think racism is present everywhere. It's present in society is present. It's present in medicine. You know, there are many biases that have been present in medicine since the beginning of, you know, the birth of medicine and OBGYN. You know, if you go way back in history, you'll see where, you know, Black women were used as research subjects without their consent in horrible ways. And so some of that, unfortunately, has been carried through to now. So, you know, one reason I even brought this topic up to you was because I had a talk with my staff after the protests really got started and these things were happening. And we talked about how we need to be more aware of it when we're addressing and talking to our patients. Actually, my PA, who is Caucasian, brought this up to me and said, you know, I just had a visit with one of my Black patients, and, you know, she was very sensitive to what's happening, has been very aware, and has been educating herself. But the patient actually asked her, you know, you need to ask your Black patients how they're feeling about this. You know, don't just brush over it. We all need to talk openly about it. And I said that that's a really good point. And so as a staff, we've been trying to be more proactive and more intentional in talking to our Black patients, our patients of all types. Clearly, we treat all patients, but particularly our Black patients and patients of color, asking them, how are you doing? This is a very, very tumultuous time. The protests are happening, these killings are happening, you know, the fighting is going on with police brutality. How are you dealing with it? You know, it's almost yet another layer of thing we have to think about now during the visit, the clinic visit, is how are you dealing with all these things happening? Ask them about it.
So tell me about some of the issues that race has on our patients, the behavioral and physical aspects of race. How do they affect our patients?
Yeah, it's another level of stress. You know, it's something else that is on their mind when it has to do with just living and walking. I was talking to one of my middle-aged Black male patients who's dealing with prostate cancer and hypertension, and, you know, we were having a regular follow-up visit, but I was heartbroken talking to him about how he's been trying to get healthy and get off of he wants to be able to come off his blood pressure medication, so he's working really hard on his exercise and his diet. But he hasn't felt comfortable with walking in his neighborhood recently, you know? So he hasn't been exercising as much because he's afraid, literally, of having the police called on him in his own neighborhood. I mean, you know, think about that. That's heavy. And so the fact that he has the level of stress, that extra level of stress of fear, which clearly, as we know, impacts all parts of mental and physical health. But now he's not even able to exercise the way he normally would because he's fearful. So, you know, it just takes that little extra thought just to kind of think, you know, what kind of environment the patient is living in. We have to ask them about it and see if we can fix it in some way.
Now, for those of us who don't have the lived experience of the Black community, what are some ways that you can suggest for us to educate ourselves? Where can we find resources to help?
Yeah, well, you know, with the Black Lives Matter movement, you know, if you research or search the hashtag Black Lives Matter, there are lots of resources online in the internet and different organizations that you can become a part of or donate to that can be very helpful and educational. You know, I've been overwhelmed with the amount of colleagues and friends that have reached out to me, non-Black colleagues have reached out to me saying, you know, I'm embarrassed. I know that I've contributed. I want to intentionally be anti-racist. What do I do? You know, after about the 10th person, it became a little exhausting. Although I'm very appreciative of folks wanting to be awake during this moment, but doing your own research definitely helps. So I think there's another, my other favorite book that's been talked about a lot is called White Fragility. And that's another one that brings, you know, it's very controversial, but it talks, you know, about some honest things when it comes to the uncomfortable discussions that we need to be having with our family, with our friends, and, you know, helping folks to realize what their own biases are.
Let's take a step back. And I was wondering if you could share with my audience something that you've been curious about or something that you've been passionate about recently.
I guess this more. I mean, you know, dealing with COVID-19, with quarantine, and having to stay at home more and be present here with my family. You know, all this is happening at one time, at the same time, and then the extra layer of the protests and the fight against police brutality is happening, I definitely, I'm not, and I've never been someone to really speak out on a from a political perspective, but because this affects so many different parts of people's lives, I feel like I need to be more vocal. So I have gotten more involved and more vocal in the movement towards anti-racism and how our non-Black colleagues can be more involved and have less prejudice. So I guess this is what I'm becoming more passionate about.
So we're talking with C. Nicole Swiner. She's a family physician, and she's also an author, speaker, and publisher. So my final question, Nicole, what's your take-home message for the Kevin MD audience?
Just be present. Be present. We tend to shy away from those uncomfortable conversations and things that make us feel uncomfortable. If you see something happening that is negative, if you hear your relative making a racist comment at the Thanksgiving table, if you see police brutality occurring, or if you have that feeling of needing to call the police, take a step back and think what can happen to this other person and address it right then and there, because it could literally save someone's life.
Well, thank you so much for sharing your advice, insight, and wisdom. How can people find you?
I'm at Doc Swiner on almost all social media, Instagram, Facebook, LinkedIn. So let me know if you need my help.
All right. Thank you so much for joining us on the show.
Thank you.